cardiac surgeon. I was working in government hospital for almost 30 years. I retired and also worked in a private hospital for another 10 years. Now almost 40 years of experience with the cardiac patients and diabetes and hypertension patients. And presently now I am practicing at T Nagar Bharataraja Hospital and also my consultation at Pallavaram, Chennai. So today I will going to talk about diabetes and heart care management. Okay. So at present, heart disease remain the leading cause of hospitalization and death in patients with diabetes. Patients with diabetes and hypertension, most of them know it is a silent killer disease. So it can cause heart attacks and strokes like paralysis, and also kidney failure, and also loss of vision. And sometimes you may lose your foot and limbs because diabetes will damage the blood vessels of our body from head to foot. All the tissues are supplied by blood supply with oxygenation. The high sugar in the blood can cause damage to these vessels. So patients with diabetes more likely to have twice heart disease, heart attack, or heart failure rather than non-diabetic patients. So you should be very careful, especially if they have long diabetes, chronic. If the age is above 65 years, 50 to 60% of patients will have heart attacks. So we have seen in our practice nowadays that is more common, especially in India. Diabetes, especially in Tamil Nadu, is more prevalent for diabetes because of lifestyle. We have to change that pattern to our old system. That is my advice. So going into the details about this, heart diseases will come because the high blood sugar in our blood can damage the interior vessels, which cause cholesterol changes and fatty streaks, which reduces the flow or blocks the artery which is going to supply the heart muscles. That is why heart attack comes. And also the muscles which gets blood supply also gets damaged. So heart failure also is common things in diabetic patients. So how to prevent these problems? First, you have to have control of the diabetes. Diabetes, sometimes it is uncontrollable because of our lifestyle, unhealthy food habits, non-sleeping habits, high fatty diets, also a stressful life. These are all the causes of heart diseases and also diabetes and hypertension. If you have a healthy food habits and moderate exercise, non-smokers will not get heart problems. So be careful. Whoever having diabetes, they will have heart attacks twice than the person without diabetes. So to have heart attack to prevent, we should have a good healthy lifestyle. And so the blood diabetes not only have heart attacks and heart failure, also have stroke and also loss of vision and also heart failure. And sometimes blood supply to the lower limbs will be blocked, and you are supposed to have limb ischemia, and sometimes you need amputation of the foot and toes. So heart diseases, how will you diagnose? If you have the diabetes, hypertension, or high cholesterol, you should have a checkup. People are scared to go for checkup because the doctors will say this is there, that is there, then you need treatment. And most of them, they are irregular. Once they symptoms become all right, they just leave the medicines. They will come after 6 months to 1 year, land up in ICU admissions for so many failures problems. So they should have continuous checkup, must have check once in a year, and advise whatever doctor's medicines. If the medicine doesn't suit some problems after effects, they should go back to the doctor and tell, this is my problem. They can change the medicines and they advise accordingly. So for to prevention of the heart diseases, you should have ABCs in my mind. Number one, HbA1c, which has 3 months blood sugar level it should be below 7. That is the one which we have the baseline to control whether diabetes controlled or not. Controlled diabetes will not have any issues. Only uncontrolled people, irregular on medication, they will end up in problems. Number 2, B. A is HbA1c. Number B is blood pressure. Should be below 140 by 80. You should maintain it. Should not. Most of them, they came with high blood pressure. They may not have symptoms. I don't have anything, doctor. I don't have headache and giddiness. Then why should I come to? So not necessary everybody will develop complaints, not necessary symptoms. Only 30% will have symptoms, 70% they are asymptomatic. So they once they become above 40, 45 years, they should go for a master check once in a year at least. Do the basic blood test, sugar, urea creatinine, cholesterol, BP, and take on ECG and you go. And if necessary, you go for angiogram also to rule out heart diseases. So for preventions, these are all the investigations we do routinely once in a year, or if necessary in between. So for the treatment, I already told the healthy diet habits of fruits, vegetables, and whole grains. Should avoid fatty diet like fried things, especially after 40. Growing age, you can have anything diet you want, no restrictions. After about 35 to 40 years, you should restrict, especially if you have comorbid like diabetes, hypertension, high cholesterol, or a family history of sudden heart attack or sudden cardiac death. You should be very careful. You should not go for sudden strenuous exercise. You should moderate exercise, walking soon, and also green vegetables. Plus, should have a good sleep and you should have meditations like that. So if your lifestyle modifications plus having this checkup and also to quit smoking, which is the commonest cause of heart attacks and stroke, should avoid. These are all the you have this sort of aging is one of the reasons for heart attack that we cannot prevent it. But with a good lifestyle, walking and good healthy food, we will definitely will maintain our heart till 100 years. Most of we have seen people who live with 100 years without even hypertension and diabetes. We should have the goal to have such a lifestyle to avoid this heart diseases, which is more prevalent, and most of the ICU admissions are due to blood pressure, hypertension, and high cholesterol, which blocks the arteries, which cause strokes and heart attacks and heart failure. So that is my sincere advice. After 45 years, we should go for a health checkup, continue to have medications if you have diabetes, hypertension, and cholesterol, quit smoking and alcohols. That is my sincere advice to have a healthy lifestyle and good life. Thank you very much for your listening. My wishes for all the viewers. Thank you.